Shalom again, and hello everyone. I'm excited to be back with you again to share part 2 of leadership in academic medicine. Today we'll focus on leadership theories, specifically situational, transformational, and team theories. These theories have become popular in the last 50 to 75 years, and I use tenets of these theories in my leadership philosophy. In particular, ideas around situational and team leadership have helped guide the ways I lead at Vanderbilt. And this presentation builds upon my professional experience as well as my academic studies in leadership. Dr. Vaughn, after this workshop, you all should be able to select leadership actions appropriate to the situation, task, and members, use transformative leadership styles and strategies to inspire followers to action, distinguish between phases of team development and the leader's role. And there will be time for case studies, self-reflection, and small group discussion. So I used to think of leadership as being all about traits that you were born with. And we briefly touched on this last time as some of the older leadership theories. But after participating in a year-long leadership program and studying leadership for my doctorate, I've come to understand that there are many types of leadership, and leadership doesn't depend on being born with the right skills. Leadership is often a process of growth. And importantly, leadership is about responding to the situation, inspiring your followers, which you all identified last time, and engaging followers in team-based approaches is necessary. As we move through this session, think about how the varying elements of leadership will help you form your leadership philosophy. We'll look at 3 recent forms of leadership: situational, transformational, and team, before discussing how to develop your leadership philosophy. Leadership capacities can be thought of in 3 domains. External environment skills, which includes networking and knowing what is going on at other hospitals, in the community, and in the health sector, includes team and organizational skills, and managing your self skills. Last session, we focused largely on managing the self when we discussed social and emotional intelligence. Today, we're going to dive deeper into team and organizational skills. There are 5 domains of medical leadership, and we will focus on setting direction and working with others, which align nicely with team and organizational skills. We'll start with a case study. Consider this scenario. When working as a consultant, an anesthesia in-room provider, so non-physician anesthetist, disagrees with your anesthesia plan. Instead, he suggests a different plan. While his plan is not the best, it is something that could be workable and the patient will still be safe. So, 2 questions for discussion. How should you proceed? Do you insist the in-room provider does exactly what you said, or do you do the plan he or she proposed in order to create a good team environment? And what should you consider in making your decision? So great. So, some of those considerations you mentioned and other ones would be considering the relationship between you and that in-room provider, considering the task, your level of authority, and the followers, so the in-room provider's level of maturity, their experience, their temperament, their communication style. So a key task of leadership is knowing which of the range of leadership skills are appropriate in any situation. So for example, in that case study, you had to know what some of those dynamics were and some of those factors were to bring in. And so, thinking about another example where you might consider a range of leadership skills, what's appropriate for the situation. If you're planning a new staff break room, you would likely need input from many people, but if a fire breaks out, immediate action and direction are needed. So situational theories propose that leaders choose the best course of action based upon situational variables. Effective leaders adapt their style to the situation. Different styles of leadership may be more appropriate for certain types of decision making. And as I mentioned, leaders should consider leader-follower relationship, the task, the leader's level of authority, and the follower's level of expertise and communication style. So in the situational leadership model, Kenneth Blanchard proposed that the leader is responsible for changing his or her behavior rather than for changing the follower. In this model, there are 4 main ways to lead based on the level of support. So you can see that on the y-axis, and the direction that the followers need. So think about your teams, residents, and followers. When the followers are unskilled and they lack experience or are new to the task, but have a desire to learn and are willing to take direction, they need directive leadership, a high level of direction, but perhaps a lower level of support and motivation is needed. Now, when the followers and your team members are more skilled, but not quite yet competent, they may still have inconsistent performance, but they definitely are unmotivated and maybe not fully on board with goals. They need a coach. They need high levels of direction and motivation or support. And so they need that coach from the leader. Now, when your followers have demonstrated skills and are experienced, but they're hesitant to commit, they might lack confidence as well. They need a supporting leader and less direction. And then finally, in this model, when your followers are skilled and proficient, they consistently complete their tasks and are reliable, when they're maybe a self-starter and goal-driven, they need a leader that will provide autonomy. So you would step back as the leader, delegating tasks and allowing them freedom to work. Using this model to reflect on my workers' needs and align my direction support with what they need has been very helpful. And so I'll share a brief story. Just recently, I was having trouble with one of our newer employees. For a couple of months, I felt like he was underperforming and I was frustrated with his lack of proactivity. So I had what we call at Vanderbilt a coffee conversation, or an informal but structured conversation with this new worker. And in our meeting last week, I asked him how he thought his work was going, how he was understanding it, and how we could support him. As he talked through things, and as I provided observations, so that evidence you mentioned, Dr. Aman, about his work, I came to a better understanding of the leadership and management oversight that he needed to flourish. I'd been assuming that he was up to speed on our work and needed low levels of direction support, so I was a delegating leader. However, he identified that he doesn't yet have all the skills needed and needed more direction. Since he's highly motivated, I realized that a directive approach was needed. As he develops professionally and gains more skills and confidence, I'll pull back into a delegating role. So think about situations where you lead. Do members need high or low levels of support from you? Do they need high or low levels of direction? Being able to read the situation and understand the needs of the members will help you to select a leadership style in which members are able to flourish, because you are providing a level of support and direction that aligns with their needs. So I'll pause for a moment so you can think about your teams, and hopefully you have been. What areas does this ring true? Have you had experience where maybe your leadership is misaligned with what people need, and maybe you've corrected it, or you're thinking about a situation where you might apply a different type of leadership now? I'll let you keep thinking on them. We will move on to talk about transactional and transformational theories. So if you read the Van Diegel article that was assigned for this week, or if you think back to our discussion 2 weeks ago, what are elements of transactional and transformational leadership? How would you describe those, or even just one of those theories? So transactional leadership is about holding people accountable to act, and transformational leadership can simply be said as influencing individuals to act. And this creates a greater buy-in because people are motivated to act. Let's look a little bit more deeply at them. Transactional leaders focus on the role of supervision, organization, and group performance. Leaders focus on specific tasks and use rewards and punishment to motivate followers. In effective transactional leadership, the chain of command is definite and clear. The primary goal of followers is obeying the instructions and commands of the leader. Subordinates need to be carefully monitored to ensure that expectations are met. And this is a very managerial form of leadership. Followers are not encouraged to be creative or to find new solutions to problems. Research has found that transactional leadership tends to be most effective in situations where problems are simple and clearly defined, so this form works well in crisis situations. Now, transformational leadership focuses on the connections formed between leaders and followers. Transformational leaders motivate and inspire people by helping group members see the importance and higher good of the task. While these leaders are concerned about performance and involved in the process, they focus on helping every member of the group succeed. Leaders with this style often have high ethical and moral standards. Leaders believe that their followers will do their best when inspired and empowered. Groups led by this type of leader tend to be successful and loyal, and members give a lot to the team and care deeply about the group's ability to accomplish its goals. Group turnover tends to be quite low because transformational leaders inspire commitment in their followers. And recent leadership literature for the past few decades has focused on transformational leadership. So we're going to take a closer look at these theories. Are there any questions or thoughts about transactional and transformational leadership? We'll move on and we'll focus on transformational leaders and leadership, which is a very inspirational model. Some people may